The Affordable Care Act is here, and Blue Shield is here to help you figure it out. So you've probably heard one or two things about America's law for health coverage. Now, the Affordable Care Act requires that by March 31st, 2014, most Americans purchase health coverage. So if you already have health coverage, probably all set, but there's still a couple of things that you might want to learn. And if you don't have coverage, or you're not totally happy with your health coverage, or if learning about health coverage is your hobby, which would be extremely weird, stick around. We're going to take you through a fascinating journey through the world of health coverage for individuals and families. Okay, fascinating might be a little bit of an exaggeration, but we will do our best to explain things and to make understanding the Affordable Care Act as easy and as painless as possible. Let's go. Okay, so the new law says if you don't have health coverage, go get health coverage. It's probably not what you woke up wanting to do this morning. But it's also probably a lot less complicated than you think. So let's start with some good news. A lot of you out there don't have health coverage today because you have a pre-existing medical condition, which is kind of why there's a new law. That is no longer an issue. Under the new law, no one can be denied coverage for pre-existing conditions. Things like asthma, or heart disease, or high blood pressure may be considered a pre-existing condition. And I know what you're thinking. No, you won't be charged a higher rate for it. More good news. This isn't bare minimum level coverage. It's really good stuff. All the plans include the same 10 essential health benefits: ambulatory services, emergency services, hospitalization, maternity and newborn care, mental health, behavioral health and substance abuse services, prescription drug coverage, rehabilitative and habilitative services and devices, lab services, preventative and wellness services, and chronic disease management and pediatric services, including dental and vision care. All the new plans sold on or after January 1st, 2014 cover all these things, so you don't need to go get a microscope to compare coverage levels between plans. Those 10 areas, always covered. Speaking of costs, there's even more good news. I know that sounds weird, but it's true. Some of you will be eligible for federal subsidies, as in Uncle Sam kicks in for some of the cost of this coverage. If you're wondering if you qualify, and if so, how much, just give us a call at 1-800-660-3007. And even if you already have a health plan, we might be able to help save you some money, or just make sure that you're getting precisely the coverage that you want. Oh, hello, my phone is blowing up. Okay, don't call yet. Please watch the rest of the video first. We're not going anywhere. So if you're like most people, you want the most health coverage for the least monthly rate. So of course you're gonna shop around. Now you can purchase health coverage directly from Blue Shield, or you can use a broker, or you can purchase through the new state health insurance exchange. It's called Covered California. Covered California is the new insurance marketplace in California where you can compare different plans. It's also the place to obtain coverage if you're eligible for federal subsidies. So as of October, you'll find 4 different plan levels available. They're called metal levels, and all of them cover the same things, but the costs are different. So let's start with the bronze level plan. Bronze offers much lower premiums. That's your monthly payments, but it has higher co-payments and co-insurance. That's your out-of-pocket or share of cost when you access services. And higher deductibles, which is the annual amount you pay out of your own pocket before the plan pays benefits. Next is the silver plan. Slightly higher monthly premiums, slightly lower co-payments, co-insurance, and annual deductible. Then the gold plan. Higher monthly premiums, lower co-payments, co-insurance, and no annual deductible. And finally, the platinum plan. Now, you probably figured this out by now, but under a platinum plan, you'll pay the highest monthly premiums, but have the lowest co-payments, co-insurance, and no annual deductible. Okay, so let's say you don't have any health coverage at all. Don't panic. Under the new law, you've got more options than ever before. You can buy directly from Blue Shield, use a broker of your choice, or purchase through Covered California. As long as you're covered by January 1st, 2014, you're good to go. And if you need help, Blue Shield is here. Just call 1-800-660-3007. So there's a bunch of you who are probably saying, I already have health coverage, I'm happy with my coverage, stop talking to me about coverage, I'm covered. You're right, okay, you may be. And if you purchased a Blue Shield plan before March 23rd, 2010, you're done. You don't have to do anything if you don't want to. Your plan is grandfathered in. Just keep paying your monthly rates and you can keep getting this coverage. Still, you might want to call us at 1-800-660-3007. Not only do we love the sound of your voice, we can help you find out if you're eligible for federal subsidies. Ah, there goes my phone again. I'm so popular today. Okay, let's say you already have Blue Shield coverage, but you purchased it after March 23rd, 2010. Most of you will need to switch over to one of our new Affordable Care Act compliant plans. If you're currently a Blue Shield individual plan member, we have a new plan recommended for you. If you like our recommendation, you don't need to do anything. It's totally automatic. But feel free to give us a call if you want to review any other plan options. The Affordable Care Act requires all plans to provide more coverage, so there may be an increase in the monthly rate that you pay. But the good news is we can help you find a plan with a rate that works for you. We can even walk you through the process of getting a new Blue Shield plan through Covered California, so you're sure to find the best fit for you. Don't be shy, give us a call. We'll let you know what's changing and see if we can save you some money. So those are the basics of the Affordable Care Act. We hope it was helpful, but remember, if you have any questions at all, we're always here to help. You can visit our website, you can chat us up on Facebook, or just give us a call at 1-800-660-3007. As a not-for-profit company, Blue Shield has always put care before profit, and we're excited to be able to help more Californians than ever before. You can do this. We're with you. Thank you for watching.